Warm welcome to you if you're just joining us on Facebook, LinkedIn, YouTube, or Twitter. I'm Rida Sadki from the Geneva Learning Foundation, and I'm here with, we'll be starting in just under 2 minutes with Charlotte Mbou from the Foundation and Julie Jacobson from Bridges to Development. We'll be talking about neglected needs of women's health, and thank you for being so great in numbers responding to this. Seeing how many people did respond, it feels like it's hard to imagine that these needs are being neglected, but that's precisely what we're going to talk about, the challenges around this, and then specifically around female genital schistosomiasis, FGS. So in 1 minute and 30 seconds, stay with us. We'll be right back. Warm welcome to you. I'm Rida Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbou, also from the Foundation, and our guest today is Julie Jacobson. A warm welcome to you, and hello, Charlotte.
Hello, Rida, and hi to everyone that's joining us today on our various platforms. It's always a pleasure to be with you.
Wonderful, and Julie, welcome.
Thank you. Pleasure to be here.
All right, so what are we talking about today? Well, let's go and have a look. This is from our Facebook page, but you may be on YouTube, LinkedIn, or any other platform where you'll find the Geneva Learning Foundation. So we're pleased to welcome Julie. She is a global health leader, physician with a lifelong commitment to addressing complex public health issues with creative problem solving. And we're going to be talking about her, pretty much, as I understand it, lifelong commitment to one particular problem, female genital schistosomiasis, so neglected tropical disease. Charlotte is going to be asking the questions. Would you like to kick us off? This is a 15-minute Global Health Symposium, so a very ambitious agenda for the next 13 or so minutes.
Yeah, so I'm just going to go straight to the point, Julie, and thank you for accepting to join us today. The first question, can you tell us who you are, where you work, and what you do?
So my name is Dr. Julie Jacobson. I'm a primary care physician by training, but I've had training at the CDC in applied epidemiology and clinical tropical medicine training, which brought me into my lifelong commitment to really working on neglected diseases and neglected problems around the world. I work with a group that just recently formed, I brought together called Bridges to Development after several years of working at the CDC PATH, a nonprofit in Seattle, and then the Bill and Melinda Gates Foundation.
Okay, so why female genital schistosomiasis? Why is it important to you? How does it affect an estimated 56 million women and girls? No, I know that's too many questions, but
a lot of questions, but it's a big problem, and it's kind of inconceivable that something that big can be so invisible. And so for me, one of the reasons why this is such a passion for me is that you have a problem that women don't know that they're infected. The health system has ignored and not seen this problem. And so it's never gotten the attention that it needs. And you have millions of women and girls that are needlessly suffering. And what you can see looking forward is that tide of women and girls is not going to stop, and it's a solvable problem. And so it's up to us as a global community and people living within those countries to be empowered to know that we can solve this problem. And so that's what brings me here today.
Okay, so what is FGS? Its cause, its consequences, its cure. So what is it all about?
Well, FGS, in addition to having a terrible name, is a really bad infection. So it's a parasitic infection. And so it's a parasite that women and girls and all people within the community, but we're talking about particular effects on women and girls right now. But with contact with water, the parasite actually penetrates the skin, and then the parasite gets into the body. And so nobody's doing anything wrong. This is in your activities of daily living, fetching water, bathing the children, washing clothes. People are exposed to the water, contaminated water, and they get exposed to this parasite. And with that parasite then comes into the bloodstream, and it lives within the vasculature, the blood vessels in the pelvis. And so you have the parasites that are releasing eggs there, and those eggs go into the tissue and cause an inflammatory response. They cause an immune response, and that results in pain, a number of different symptoms, including infertility, pain, and all of these symptoms get confused with other infections because people aren't expecting to find a parasite in the genital tract. And so it gets misdiagnosed as many different things, including sexually transmitted infections. It also results in women being more susceptible to the acquisition of HIV. So this is a huge issue and something we really want to do because it is a preventable and treatable risk factor for HIV.
Yeah, so thank you, Julie. Why is this an important public health concern that should not be neglected? Are there some countries that are more affected than others?
Yeah. So this is a particular problem in sub-Saharan Africa. And so if we look at, that's the area where this particular parasite is endemic, and so where the exposure happens. And it's a real important health problem because if we look at it through many different lenses, and one is that if we look at the HIV epidemic, one of the areas that's the most challenging is young women in sub-Saharan Africa and the acquisition of HIV in that population. And so one of the things that we may have is we may have a secret risk factor that people just don't even know about or know that they have that makes them even more susceptible to the acquisition of HIV. And because we can take on and prevent that, we have an obligation to do something. But in addition to that, it has all of the symptoms that you have from this. There's discharge, there's pain, there's bleeding that happen with this, there's infertility. So all of those things are frequently looked at and thought of as being other infectious diseases. So women are treated as if they have a sexually transmitted infection, which they don't. And they go through this endless cycle of being treated and not actually having what they're actually infected with being treated. So they are misdiagnosed and mistreated. At nobody's fault because nobody's aware.
Okay, so let's now zoom in on the aspect of training. So let's talk about the upcoming FGS workshop. What is it about?
So, well, it's actually the whole point of it is to try and reach people who are working with and treating women and girls in these settings and helping them to understand that the infection exists, how to diagnose it, how to treat it, how to prevent it, where to refer, and to begin these conversations at the national level in endemic countries, because how this is treated within the health system has to happen and is best solved by people who work within those systems to be able to figure out how to deal with it in their own setting.
Okay, so who should join the workshop, and what does one stand to gain by taking part in that workshop?
So I think the best piece is for people who work within any part of the public health system or health system in endemic countries. So basically in sub-Saharan Africa, in any region of the world that is schisto-endemic, which is a large portion of sub-Saharan Africa. That would be the perfect people. So it doesn't matter if you're working at the community level, because there's a whole set of things you can do on the prevention piece, but also if you're treating women and girls, and particularly people who work in sexual and reproductive health, and will work with women and girls in those ages and providing those services. This would be very beneficial for them.
Okay. So now I just want to, I know many people are watching also on YouTube, Facebook, Twitter, and LinkedIn. So you feel free to ask your questions in the comment section, and Reda is keeping an eye on that. He'll directly read out those questions and share them with Julie. So Reda, are there any comments coming in through our various platforms?
So I think there's a lot of interest. The announcement reached more than 1,800 people. And what we're seeing is, I just want to say, people are saying hello right now. Remember, you only have 15 minutes to ask your questions. So hello back to Prudence Adwoa Boadi, who is watching from YouTube, Diakite Umar, Mercy Onu Peters watching from Nigeria, who says greetings to all, Obed Tamwasi and Kashama, who says thank you, actually merci beaucoup pour cette séance, Nefertiti Dakenyo, who says hello as well, Atahir Abubakar from Nigeria, Billy Kunjan, who says je suis là, I'm here, Winnie Chepnengeno from Kenya, apologies for mispronouncing your or anyone else's names, and then Muneko Joseph Paul watching from Mbale, Uganda. So that's what we've got so far, and for Joseph, Winnie, Billy, Atta here. Okay, so we've got a first question from Prudence. Which part of the genital does FGS actually affect?
So that's a great question. And so when we think about the parasites, they live in the venous plexus of in the vasculature around the bladder and the pelvis. So the eggs get implanted throughout the vaginal tissue. So it's in the vaginal and cervical tissue. But the classical piece of this is looking at lesions that occur on the cervix, but they can occur in the cervix or vaginal tissue all around. So it's throughout the entire genital tract. And it also affects men, just to let you know. And so it also affects men in the genital tract as well. So there are repercussions for men as well that are infected.
And just to say Prudence's question, Prudence is calling in or watching via YouTube from Ghana. Is there something to say specifically about Ghana and perhaps one other country?
Yeah. So the training that we're working on right now is a pilot, and it's really trying to reach out to. We have resources supporting particularly Ghana and Madagascar. We would really strongly encourage that anybody who's working medically in Ghana or Madagascar participate and join us in this piece, because we really want to reach out to those countries. We're going to be looking at how effective this is and how we can do this and how we can reach people more, how we can use the experience there to reach others to ensure that we get this information out throughout sub-Saharan Africa.
We also want to say, I believe that, even if you're not from Ghana and Madagascar, that should not discourage you from actually applying for this workshop. And this is one of a set of activities of what is called the FAST package. So we have our second question. This is from Winnie Chepnengeno. And Winnie is calling in from Kenya, and she wants to know, what are the pathogenomic features of FGS? Pathogenomic features of the FGS.
Pathognomonic. There we go. The features there are, you have, let's see, that's one of the big challenges of this, is that it mimics a lot of other infections, and people think it's something else. So you have vaginal discharge, you have bleeding, you have pain on intercourse. All of those things are symptoms of FGS, and infertility can also be, and ectopic pregnancy can also be caused by this. So you think of the inflammatory situation that's happening throughout the genital tract. And then you can have the eggs of this parasite that actually get into the fallopian tubes and block transmission of the eggs. So that can result in infertility and ectopic pregnancy. So it affects throughout that area. And Retta mentioned, so this project and this training course is part of a project called the FAST package. And so the idea of this is that training people to understand and know what FGS is only one part of the solution that we need to be thinking about. Because the problem is that people don't know they're infected. If they're referred to the health system doesn't recognize the infection. So it's the whole system is broken. And so the FAST package has a set of activities that are working at the community level, working within the country to set up committees to help deal with this and integrate the treatment for FGS into the overall health system, in addition to the training component of the medical and health practitioners in the country, so they're prepared to diagnose and treat and prevent FGS through their role within the health system. So the FAST package is looking at putting all of those interventions into one set of activities at the national level so that we can prevent and treat and refer FGS appropriately.
Great. We also want to greet Bose Akinbolusere, or Bose, who says, hello. Bose, please tell us what city and country you're connecting from. Same for Johnny Castro. And I want to greet Ruth Alote, scholar, alumna from Accra, Ghana, who says, hi, everyone, and thank you. And then Johnny Castro has the next question. How can FGS be differentiated from Trichomonas vaginalis? And this is Johnny from Cameroon asking this question.
Thanks for the question, Johnny. I mean, I think this is one of the pieces is that when you're looking at FGS, you need to be ruling out other things because there also can be co-infections. We know that people are not infected with only one thing. So, so you would have to do your normal diagnostic pieces for diagnosing TRIC. There are diagnostic tests for schistosomiasis, but the challenge with this is that looking at the active, we'll go into this a lot more in the training course because, of course, there's a lot of subtleties and different pieces in this. So don't think in this 15 minutes we're going to get it all. And that's a good reason to come to the course overall. So we have diagnostic tests for schisto, and so those play a role within the piece of looking at the risk and the potential diagnosis of FGS.
So the principle of the 15-minute Global Health Symposium is that we only have 15 minutes, so we're not going to cover anything in depth, but there's going to be just enough for you, who you're listening, to know, is this an issue that is of concern to you as a health professional? Is this something you want to learn more about? And then, as Julie announced, we have this upcoming workshop, and you can request the application right now. So we actually have the next question comes from Barack Kweku Ernest, who wants to know, are there implementation scientists on board in what Barack calls this integration quest?
Oh, such a great question. Yeah, this is definitely an integration challenge, right? And so integration science is a huge piece of this. So we would love to see that FGS becomes a natural part in the HIV prevention work that happens at the national level, and that when women are being screened for cervical cancer, for example, where they may be having a pelvic exam, that the practitioners are aware of what this looks like, because this could be confused with cervical cancer because you see an inflammatory response on the cervix that could be confused. So being aware of what these lesions look like, how they differentiate from cervical cancer lesions is really an important part so that women are appropriately treated and not misdiagnosed or over-treated for something that's a parasitic infection, believing that it's cancer. So this is an integration problem. You're exactly right, and this is exactly what we would love to overcome that challenge, particularly with this project in Madagascar and Ghana, and then have that spread throughout with the knowledge and experience of people who will be attending the course in this peer-to-peer training and innovation that will come from the members that are coming to the course itself, in addition to the people that will be coming and helping provide some information to build that education off of.
So I've actually got a question for you, Julie, but there's a question much more interesting than the one I wanted to ask from Mercy Onu Peters. And so Mercy wants to know, since is found in it's been found. It was FGS was found a long time ago, and then only found in Africa. Why haven't they gotten a cure? She wants to know. I believe a lot must die of this ignorantly, and how long will it be with patients before getting to the stage of cervical cancer? Would you like to unpack that question and sort of provide the facts about so Mercy can understand what's happening?
Yeah, so the parasitic infection, bilharzia, is the other name of schistosomiasis in Africa. And so bilharzia has been around for a long period of time. Classically, schisto was understood to affect the urinary tract. So because people, when they get infected with schisto, well, the eggs releasing into the bladder cause bleeding, and so you get red urine. So you get bloody urine, red urine. And so that's been a common thing that, and people thought for a while that was just a natural part of growing up, but it's actually a sign of the parasitic infection. The fact that it affects the genital tract was partially a problem because it was named urinary schisto, so it's part of the urinary tract, and so it didn't become part of the training and understanding that it actually affected the entire genital tract. So it's been an ignored and misunderstood issue for a long period of time. And as I said, because the symptoms mimic other things, it's been believed that it's been other infections, and so it's been hidden underneath this veil. And so, and then there's stigma that gets associated with infections like this. If a woman's accused of having a sexually transmitted infection again and again and again, you can understand that this will have repercussions on her personal and family life. And so it's been a misunderstood issue within a lot of the health system as well. So the risk of misdiagnosis and the risk of HIV acquisition do make it a life-changing and life-threatening issue. And so this is where we want to change that by increasing awareness and making sure that it is integrated into the health system and seen as an issue that is a solvable problem, because there is a treatment, praziquantel, that is available and does treat the parasitic infection. And we need to get that out to women and girls. We need to get it out to communities to both let them know about the risk factors for this and how to prevent transmission and how to get treated early in order to prevent the female genital schisto from ever occurring.
Thanks so much. Julie Jacobson is speaking with us about neglected needs of women's health and specifically female genital schistosomiasis. Johnny Castro wants to know, so what's the current trend of FGS?
It would be really hard to say what the trend is because the diagnosis has been so poor and so poorly recorded. And that's one of the things we need to do by training the health system and ensuring that FGS is reported within the health system. We can start to see those trends and be able to see, is it increasing? Is it decreasing? Because we have very interesting things when we start to look at the transmission of schistosomiasis, because we have as you all know around the world, there's been peri-urban acquisition of people coming into the urban centers, and in those you have a lot of stagnant water, you have a lot of people then contaminating water and people having to have contact with that water for their for cooling off, if not for cleaning and using in other uses within the home. And so we have spread in areas where we didn't see before. So I think we need to be really sensitive to the fact that we think we know where schisto is, but we need to be on the alert that it could be transmitted in additional parts. So I think the data is poor on being able to understand exactly where it is. Although we know the regions of the world that are endemic for hematobium, schistosomiasis hematobium, this particular parasite, we need more data. And you all that are listening and would come and be part of this course would be part of creating that information and coming up with the solutions to try and solve this global health problem.
Thank you, Julie. I think Charlotte and I have a combined question that we wanted to ask together. So Charlotte had a question, about she very diplomatically asked about other public health actions needed to fight against FGS. I wanted to be a little bit more
training.
Yeah, a little bit more provocative. So I saw you do not need to have prior experience with FGS to participate in this workshop. That's wonderful. But you do need to be a health professional working in a clinical setting or providing care, support, or referring women and girls. Many in the in the Geneva Learning Foundation's network, there's a lot of health professionals from other areas. So what can they do? How can they get involved and contribute? If listening to this, and many of them are already aware of the issues, what would you suggest? What forms of action, if you're not directly involved with providing care for women and girls in an endemic country?
Yeah, well, I think so. There's there's the exposure itself, an exposure to contaminated water. And in this case, it's water that the transmission cycle comes through urine, contaminating water, which then gets the parasite comes out, and then it gets into snails, and then the snails amplify that, and then it continues the transmission cycle. So knowing about which water sources are contaminated and how to stop that by decreasing the contamination of water with urine is an important piece. So anybody who has contact with communities and can help them understand those pieces. The other part is that there's mass drug administration. So there's it's kind of like using drugs as an immunization. So there are drugs freely donated by Merck out of Germany to prevent further transmission and to treat current active cases in school-age children that's available throughout sub-Saharan Africa. And so encouraging the uptake of that. And the other piece is that what are the contact points at any time with women and girls that come from these areas, and being aware of it. And then if there is a risk, ensuring that they get preventative treatment with praziquantel is another very important part of this. And I think there's incredible opportunities to look at integrating with HPV vaccination, cervical cancer prevention, any time at which there's an educational opportunity to prevent this from happening. So I think there's it's not just people who are working in neglected tropical diseases, it's a whole health system challenge.
Wonderful. Thank you so much, Julie Jacobson. And Charlotte, what's your final thought about this issue?
I think there is still so much more to discover concerning FGS, and so much communication that has to go out there, because this is something that is not spoken about. And Julie is mentioning the other day during Teach to Reach Connect, I actually met a lady from a retired midwife from Malaysia, and she shared with me that she encountered a lady that couldn't have children because she had schistosomiasis that was misdiagnosed. And so to her, it's a story that has stayed on her mind for years upon years. And I said, it's good that you apply for this workshop and come share your experience with us, because she said they have been able to control it in Malaysia due to public health actions that were taken. So I think it's very important that we communicate more, even if it's not our sphere of practice, but we communicate more about it. Thank you so much, Julie, for answering my questions.
Thank you.
My pleasure. Thank you for all of the positive questions.
All right, and yes, if you're joining us now, or the principle of a 15-minute Global Health Symposium is that there is something you can do to learn more. And really, if you go to the Geneva Learning Foundation's website, you'll find the announcement of a workshop. Now, it's being put together by a very large group of very dedicated and committed professionals who've been working around this issue of neglected tropical diseases, and more generally, or more specifically, on female genital schistosomiasis. So it's really a unique opportunity to come together with basically some of the world's best experts. You have until April 9th to apply, and you do not need prior experience with FGS in order to participate in the workshop. Health professionals from Ghana and Madagascar are especially encouraged to apply, but again, that does not mean that if you're not from one of those two countries that you should not apply. We're very much encouraged. We want to know if you apply, you'll be connecting to a global network of practitioners, of people who want to see change around these issues. That's it for today. Thank you so much, Julie. And
just remember that there will be a session in French.
That's right, absolutely. And also tomorrow, pour les francophones, for the francophones, we're launching the Rapid Gender Analysis course. We're announcing that, and that will be offered to French speakers as well. But I know there are many of you who are bilingual who are here today. Thank you, Julie. And to all of you who followed, thank you. Mercionu Peter says, great topic. Dr. Eric Bogan Jr. I believe just joined us, but if you've been here, let us know. Let us know your thoughts. And I want to ask one last thing for all of you who are here. If you can go to the either like or, you know, put a heart, a like, a thumbs up, whatever feels appropriate. It will help get the word out about this important issue, and it only takes one click. So once again, thank you. We're going to do a quick rewind of the messages received, including the questions. So if you're just catching up, stick around for another 30-45 seconds to see some of the most interesting ones.